So now we're going to continue our poisoning case. So again, we'll go back to the emergency medicine approach. We already evaluated, thought, and act on this patient, and now it's time to reevaluate, think, and act once again. And so when we reevaluate this patient, we want to take a sample history, conduct a focused physical examination. When we think about this patient, we want to come up with a differential diagnosis. And when we act on this patient, we want to order diagnostic testing and treatment. And so let's think about the sample history for this patient. So we know that we have a 29-year-old male with altered mental status after overdose of an unknown substance. For patients with altered mental status, it can be difficult to get the OPQ, RSTU portion of the sample history. The patient's unable to tell you any of these. It's also important for a patient that is a poisoning patient to get a toxicology history. There's important things you need to ask every toxicology patient or every toxicology patient's friends, family, or EMS. You want to know the type of toxin the patient took. Sometimes the toxin's unknown, but you can ask about empty pill bottles found near the patient. You want to know the time of exposure. When did the patient ingest the medication? You want to know the chronicity exposure. Did the patient take all of the pills at once, or has he been on it a long time? You want to know the route of administration. Was it injected, swallowed, absorbed through the skin? You want to know why the patient took something. Was it accidental, recreational, or was this a suicide attempt? And you want to know if there are any co-ingestions or medications that the patient is already on. And then it's important to ask police, paramedics, the pharmacy, family, and friends about the history, because sometimes the patient himself will not be able to tell you. And so it's important to bring us to our next point of caution. You need to ask EMS for historical details before they leave. Sometimes the patient's unstable. In this case, it's okay to ask EMS to wait a few minutes until you stabilize the patient and can get a history from them. And so let's think about this patient's toxicology history. So you're able to talk to the patient's family, and you find out that they found empty pill bottles next to the patient, including lorazepam, a pain medication that was a combination of oxycodone and acetaminophen, as well as oxycodone itself. You also know that the time of exposure is unknown. They last saw the patient normal 24 hours ago, and then they found him unconscious 1 hour ago. When you ask about the chronicity of exposure, it's suspected acute, although the patient is on lorazepam at baseline for anxiety. And then you want to know the route of administration. The family and friends suspect the patient ingested these meds. And you want to know why he ingested them. The family found a note, and it was a suspected suicide attempt. And you want to know about any other co-ingestions or medications. According to family and friends, this patient drinks alcohol frequently. They're not sure if he uses any other illicit drugs, but he's not on any other home medications, and his roommate doesn't take any other medications either, so it's unlikely there were other medications in the home. And friends and family are on their way. And so if you consider the important points of the history you got from EMS and friends and family, you're able to move on and get a full sample history once friends and family arrive. So when you consider the symptoms, we've talked about those as well. He's altered. You ask about allergies, and the patient has no known drug allergies. You ask about medications. He's on lorazepam, and his past medical history is anxiety and depression. Family doesn't know when his last meal was, and the events leading up to today, where friends were concerned about worsening depression. His roommate found a suicide note and empty bottles next to the patient. And so again, you take note of the important parts of the history. And now you want to perform a focused physical exam. On a toxicology patient, the most important 4 exam findings are vital signs, a neurological exam, including a pupillary exam, a skin exam, and an evaluation for any sort of odors. So let's talk about vital signs in this patient. So we know that the patient's bradycardic with a heart rate of 60, hypotensive with a blood pressure of 90/60, and has respiratory depression with a respiratory rate of 6. He's otherwise afebrile. So in general, he has mild bradycardia, mild hypotension, and significant respiratory depression, all of which you've addressed. Next, you want to take note of the patient's neurologic exam, including his pupils. It's important to remember that sedation can affect pupil size, so if time allows, it's important to do a quick pupillary exam prior to intubating the patient and providing sedative medication. And so this patient's mental status is unresponsive, he has no gag reflexes, and his pupils are pinpoint. Because he's altered, it's difficult to get him to perform a full neurologic exam, but he's not following any commands. You check his cranial nerves and notice that he has no facial droop, although you can't check them individually. And so again, you note that this patient's unresponsive with no gag and pinpoint pupils, important findings in the neuro exam. Next, you want to look at the skin. And so for this patient, you take note of the temperature, which is cool. Otherwise, his skin exam's normal. But for toxicology patients, it's important to note whether the skin is wet or dry, to note if they have any track marks or signs of trauma, and to note if they have any blisters or skin breakdown. And finally, odors. So odors are important in toxicology patients because sometimes odors can be indicative of certain sort of toxin exposures. In this patient, there are no odors, but let's talk about some important odors found in poisoning patients. If you smell bitter almonds, you should consider cyanide poisoning. If you smell garlic, you should consider organophosphate poisoning. If you smell hay, you should consider phosgene poisoning. And if you smell rotten eggs, you should consider hydrogen sulfide poisoning. These are just a few important odors. There's a large list of odors for many different poisons. It's not important to remember all of these, but if you notice an odd odor, you should look it up and see if there's any poison that has that odor. And then finally, in some patients, there's a fifth vital sign or a fifth physical exam finding that's very important, and that's the GI-GU exam. And so in this patient, he has normal bowel sounds, but it's also important to note bladder exam, whether they have any urinary retention or incontinence. And you should also check a rectal and a vaginal exam to make sure the patient isn't packing any drugs in body orifices. And so we talked about the important exam findings in every toxicology patient, which is the focused exam findings that should be done first. But it's important to remember that every patient with altered mental status will ultimately need a head-to-toe exam once they're stabilized. And so in summary, it's important to take a focused toxicology history in addition to your regular sample history. And you should get information from family, friends, EMS, pharmacy, police, anyone you can. It's important to ensure EMS doesn't leave until you're ready for them to leave. And then it's important to note any odors because they can be a clue to the type of poison. You should focus your initial toxicology exam on vital signs, neuro exam, pupil exam, skin exam, and GI-GU exam.